A 74-year-old female with dysphagia underwent an EGD, which showed a lesion in the upper esophagus with biopsies showing high-grade dysplasia. The patient was referred for further management. On EGD, a circumferential lesion was seen in the upper esophagus, starting just distal to the upper esophageal sphincter and extending from 14 centimeters to 19 centimeters from the incisors. On narrowband imaging, abnormal intraepithelial papillary loops were visualized, consistent with IPCL type 4. Decision was made to perform an endoscopic submucosal dissection of this lesion. A submucosal injection was performed using a mixture of gelafusin and indigocarmine. Then, using a knife, incision was made in the mucosa. Within the submucosal space, the submucosa is carefully excised away from the muscularis propria underneath. Great care is taken to ensure that the circular muscle layer remains undamaged. Once endoscopic submucosal dissection is complete, the excised specimen is removed using a stere.
Since it began its work in 2012 and over the last 6 years, the Center for Interventional Endoscopy in Orlando, Florida has become a place where evidence informs clinical practice, and indeed clinical practice creates evidence, and that underpins their approach. This year at their inaugural meeting, Orlando Live Endoscopy, from August 29 to 31, you'll see some of the best endoscopists in the world demonstrating the best evidence. I look forward to seeing you there.
If you would like to watch complex endoscopic cases being performed by world-renowned faculty, then register for Orlando Live Endoscopy 2018 in Orlando, Florida, where there will be live demonstrations, didactics, symposia, and a hands-on lab in both diagnostic and therapeutic endoscopy.